Um, please hit OK, and we will get this show on the road. With that, I would like to present to you all and take a moment to introduce you to Luis Gutierrez, Latino's CEO. Luis.
Good afternoon, everybody. Thank you so much, Marcial and team, for putting this together. Again, my name is Luis Gutierrez. I'm the founder and CEO of Latinos Progresando. Latinos Progresando is the backbone agency for the Marshall Square Resource Network, and I sit as the chair of the network. I want to say a special thank you to Dr. Tanya from Rush University and Dr. Laura from Esperanza Health Centers for taking time out of their extremely busy schedule to be with us today. In a moment, I'm going to kick it over to our health committee co-chair, Raul Garcia from Sinai. But just before doing that, I want to thank all of you for all the wonderful work that you continue to do in our community. And I want you to know that whether or not you're a member of the Marshall Square Resource Network, Latinos Progresando is here as a partner for you. So if there's something that we can do as an organization, if you want to reach out with issues or questions that you have, if you want to see more of these types of webinars, please reach out to us, and we will do our best to get this together for you. We really do appreciate everything that you've been doing for our city. So with that said, I'm going to now turn it over to my friend and Health Committee Co-Chair, Raul Garcia. Raul?
Thank you, Luis, and thank you to Latinos Progresando for being the lead organization for the Marshall Square Resource Network. And as many of you know, the network is a coalition of more than 60 partner organizations that are in the area, in our Marshall Square area. And as Luis said, I am the co-chair of the Health Committee, along with Dan Fulweiler from Esperanza. So one of the goals of the committee, not only the committee but the network in general, is to share information about the issues in the community. And of course, capacity building. So as you notice on the invitation, this is an invitation for the staff members of our partner organizations. It's not like an open, invitation to all community members, but of course, everybody, are welcome here. But we want you to take this opportunity and talk to the specialists about this measles outbreak. The Chicago Department of Public Health reported until yesterday a total of 15 cases so far. I mean, that might look like not a lot, but as we know, this is an issue that could easily spread out, this outbreak. So that's why it's important to have this conversation, and we are very glad to have these two great presenters. So I'm gonna say a little about their bios. I'm gonna start with Dr. Laura Casalegno from Esperanza Health Centers. So Dr. Casalegno completed an internal medicine residency at the University of Illinois in Chicago, and she then went on to complete an infectious disease fellowship at the University of California in San Francisco, and she's a board certified in both internal medicine and infectious diseases. And currently, she practices as an HIV primary care physician and general infectious diseases specialist at Esperanza Health Centers here in Chicago. And we have Dr. Tanya Sorrell from Rush Medical Center. She is an associate professor of psychiatry and behavioral sciences at Rush. And she's the director of the Rush Substance Use Disorder Center of Excellence. And so this is a program that provides substance use education and overdose prevention services across Illinois for physician treatment programs and the general public to decrease the stigma associated with mental health. She's also on the board of directors of Cook County Health Systems at the state level as a co-chair of the Illinois Harm Reduction and Recovery Coalition, among others. And nationally, she's on the Minority Advisory Board for SAMHSA, an assistant director of the Great Lakes NIDA Clinical Trials Network. So again, thank you so much to our specialists today. Please be ready, as Marcial mentioned. You're going to have a Q&A session at the end, so please prepare your questions. And we're going to start with Dr. Laura Casalegno. Por favor. Adelante, doctora.
Gracias. Hi, everyone. I am Laura Casalegno. Thank you for the introductions, and thanks everyone for being here. I think this topic is very important. I know that probably all the people that is participating comes from like different backgrounds, different organizations. So I think it's like very important that we talk about this topic, that we go over some of the clinical stuff. I'm not gonna get too clinical because I know we come from like different backgrounds and different organizations, but I think it's important to go over some clinical stuff to suspect cases if we work with people that are at risk of getting measles, and I think this hopefully will help a little with also kind of decreasing the stigma that is around the outbreak and the people that is affected by the outbreak. So yeah, we can move to the next slide. Thank you. And so what is measles? It's one more virus that is like bothering us, one more of all the viruses that are around. So but the issue with measles is like a very highly contagious virus that lives in like nose and throat of like infected people, and it spreads through coughing and sneezing. And the issue with measles is like it stays for up to 2 hours where someone infected was like coughing or sneezing. So highly contagious and stays for long. So so those are kind of characteristics of this virus. The time that people can spread it goes from like 4 days before the symptoms to 4 days, the rash, to 4 days after the rash appears. And the good thing is like it's vaccine preventable, but what happens is like the vaccine adherence has decreased in the last like several years in several populations, and some other countries like don't have very robust or strong vaccination programs. So with that being said, there's always like cases of measles in the world. In the US, it was extremely rare until recently. I think before, I don't have the exact numbers, but I was reading something about before the vaccination was rolled out in like the 60s, there were like millions of cases in the US. And after the vaccine was implemented, the vaccination was implemented, we were seeing very, very, very few cases. It was like a 99% reduction in like the incidence of measles. So vaccine extremely effective. 2 doses of the vaccine, it's like 97% effective, and 1 dose is like 93% effective to decrease the measles transmission. So very effective. Like we know, like with COVID or with flu, like to compare, those are like in the 50-70% efficacy. So this is a pretty good vaccine, and it's a preventable disease. So I think moving to the next slide, please. What is the incubation period? And again, I don't want to get too clinical, but so we more or less know what happens after someone gets exposed. So the incubation period goes from like 7 to 21 days, with a medium of like 10 days, 10 to 12 days from someone was exposed to the symptoms that appears. Now moving to the next slide. So some of the signs and symptoms, and again, don't want to get too clinical, but these are some of the symptoms that someone can endorse or say that they are having, or someone can recognize as well. So for measles, there's some prodrome fever, malaise, and the 3 C's. So cough, coryza, and conjunctivitis. So coryza is like a runny nose. Conjunctivitis, as we all know, is like red eyes, watery eyes. So most of the patients that have measles have these like kind of like myriad of symptoms of like fever, not feeling well, having cough, coryza, conjunctivitis, which a lot of other viruses can give these symptoms. So it's important to kind of like suspect if someone has these symptoms. And then after these initial or this prodrome happens, like 2 to 3 days after, some people will develop these like very, very specific white spots in the mouth. They are called Koplik spots. And if someone has those, that's like what we call pathognomonic. So if someone has those like tiny white spots in the mouth with all the other symptoms, that's a clinical diagnosis of measles. We don't need to test for that. We will test, but I mean, clinically, that person would have measles. But not everyone has those like white spots. So after having the fever, the malaise, or feeling and sick and having the cough, the runny nose, and conjunctivitis, the rash appears 3 to 5 days after that. And the rash is pretty specific in the sense that it's a maculopapular rash. So that means that it's like kind of like red patches or like red spots. And sometimes they can have these like red spots can have like a tiny bump on it, but the bump should not be filled with fluid. So that differentiates it from other stuff, from other infectious rashes. And the rash goes from the scalp and behind the ears and moves downward to face, neck, trunk, legs, feet. And while the rash is developing, patients can also have fevers, continue to have fevers. And the fevers can be pretty high, to like 104, 105 Fahrenheit. So those are some of the signs and symptoms of measles. And now if we can move to the next slide. Here there's a picture of the rash. Yeah, thank you. No, we can go to the next one. Thanks so much. Which I think you know, Dr. Tanya will present soon, and she will give more of the current situation in Chicago and in the US, more numbers, kind of like the epidemiology of the measles. I felt like for like more important to mention also not only like the clinical symptoms, so you can suspect if someone has measles, but also what to do if you encounter someone that you are concerned that could have measles. So what I was like thinking again and again, I think we have like a lot of different organizations in the call, and I do not know all the details on how do you interact with clients or patients, so I was like putting some more generic and general information that you can find in the Chicago Department of Public Health website and also the CDC website, but essentially, what should we do if we are suspecting someone with measles? So if in your organization you're seeing clients or patients and these people are scheduling appointments like beforehand, doing a triage if someone has a fever and has like, you know, kind of like flu-like symptoms, and they have potential exposures to measles, I think and they have to go to your organization like by any means, like you can isolate those people when they arrive to the organization. The clients or patients can be put in a room, in a single room with the door closed, put a sign outside, and patients should be offered a face mask. And anyone interacting with those people or those patient clients should be wearing an N95 respirator, which, you know, again, I'm not sure like the backgrounds of all the organizations that we have here today on the talk, but the N95 respirator is like this one that should be fitted before we use it, and we should learn how to like put it on and take it out. So in order to interact with someone that is like suspicion to have measles, we need to use an N95. Of course, if someone is gonna schedule an appointment and they have symptoms and you can defer the in-person appointment, that's ideal. So patients can, or clients can isolate and reach out to DPH to get tested. So that's like what should be done before the clients or patients arrive to your organization. Of course, if they need any type of transportation from the organization to their houses or shelters or any other places, like you notify the transportation services and whomever is gonna be in contact with them. So those are things that we can do before people come to our organization. If we move to the next slide, please. So here, this is like the algorithm from the Chicago Department of Public Health. And again, I think this applies to a clinic setting, like a healthcare setting. So I don't know if this applies to all the organizations, but I think what we should probably take home from this algorithm is like, you can I move you don't see if I move the cursor, right? No, because you're sharing the screen. Okay. So if you see where it says start here, you can see what is like the criteria met to someone to suspect someone of having measles. So it's pretty broad. Fever, rash, and it says absence of vesicular lesions. I think that's like very clinical. So if you are not clinically trained and you are interacting with a client or a patient that endorses like fever and a rash, that automatically have to like make you think of measles. More so if they have the epidemiological criteria that is like below that. If you can see, I know it's like a small and kind of a busy slide, so I'm sorry for that. But if you see there's like epidemiological risk for measles within the 21 days before the rash. So staying in a shelter, being in a shelter, having had any international travel, and or having had a known exposure to a confirmed case. So that immediately puts you on like the testing kind of like criteria. So if that's the case, if you are in contact with any client or patient that meets all these criteria, I think the next step would be to reach out to CDPH and arrange testing and contact tracing and isolation. So if we move to the next slide, please. So here, I think this is an important slide because there's like the information that I'm pretty sure everyone already kind of has in their organizations, because this is being distributed everywhere. So this is the contact information for CDPH and how to report any concerns or any concerned cases that you might encounter. If we move to the next slide. Okay. And I was thinking what other things would be important to know at kind of an organizational level. And again, I am guessing that all the organizations have different protocols and different kind of like missions. So this is again a generic, so it can be adapted to all the organizations, but in a generic way, what happens if a staff is exposed to a confirmed case? So again, each organization probably will have a protocol in place, but the most important thing is like knowing if the staff member has immunity or not to measles. And confirmed immunity to measles is like having confirmation of having at least 2 vaccines to like MMR, like the measles, mumps, and rubella. So the MMR vaccine, having confirmation of that, or having written confirmation of immunity. So you can do like serology testing, like they do a blood work, and they can show that people have or not immunity to measles. So if someone that has proven immunity to measles, there's no post-exposure prophylaxis, so they don't have to take treatment if they were exposed to a confirmed case. There's no work restrictions. The only thing is like you have to monitor for symptoms for 21 days after the exposure, because as I mentioned, even though the vaccine is extremely effective, there's like a 3% that you might have like wane immunity or not be effective. So some people can get infections even though they are vaccinated. And the caveat is like some people would have a different presentation, a milder presentation, or maybe the rash would look different. So any symptoms after an exposure, like flu-like symptoms, any runny nose, any cough, any conjunctivitis, of course, those are like very concerning. But even if it's like a flu-like symptom and a mild rash, like a faint rash, I would report it to DPH, because it could be a modified presentation of measles instead of having had vaccination in the past. And I want to touch the last part and kind of quick so I can give time to Dr. Tanya. So what happens if someone does not have confirmed immunity to measles? I think at the time CDPH has to be involved, because probably that staff member needs to isolate and needs to receive post-exposure prophylaxis. That sometimes is a vaccine, or sometimes it's another medication that can be given to prevent the development of measles. And of course, any pregnant staff member should not go close to a patient that has like suspected or of course confirmed measles, or someone with like immunocompromise. So someone that their immune system is like decreased or diminished by any means. So with that, I kind of want to give the last take-home point. If any concerns for an exposure or a suspected case, reach out to CDPH. The information is there, and I hope this is helpful. And I would pass it to Dr. Tanya, that has like also a lot of valuable information in her presentation. So thanks, everyone.
Thank you so much, Laura, for your presentation. You know, this time of year, which is normally part of spring and getting ready, starting to get outside again, makes having this measles outbreak a little bit tougher to deal with, but there's lots of information that we can provide you today to help you feel confident that you can keep yourself, your family, and your kids safe. Next slide. This time of year, as we said, not only are we still dealing with the last influx of flu symptoms, COVID risks right now are still low, but other types of respiratory viruses, that risk right now is moderate because of people are still mostly inside with activities and still connecting, and not always having masks if they're having coughs or colds, because it's hard to know if you're sneezing, if it's a cold, a cough, a flu, RSV, or respiratory virus, or allergies, because now that things are blooming, there are allergies that are out. COVID-19, we're still at the lowest rate, but those same types of coughs and sniffles may be the starter of what may have been measles. So it was tougher for medical providers to recognize initially when these outbreaks occurred, because some of the symptoms were similar. Additionally, norovirus, that people normally don't hear about unless they're going on a trip on a cruise and may eat at a buffet, is also something that has been more prominent during March. And so parsing through those symptoms has been a little bit tougher, but now that we know what's happening, we can be able to do what we need to do to keep everyone safe. Next. And it's not just Illinois or the Chicago area that's dealing with a measles outbreak right now. Currently, and you can see from the map, 17 states as of this week have been dealing with measles outbreaks. So all to the West Coast, East Coast, North or South, there are states that have had issues with measles. So although if we watch the news, we only think that it's happening potentially in Illinois, but we're not alone. This is the largest measles outbreak that we've had in over 25 years. The last measles outbreak was in only 6 states in 2022. The reason being is that in 2000, with mass vaccination, measles hadn't occurred. And we actually called measles eradicated, meaning no kids were getting measles during those years. Between 2000 and 2019, there were no measles outbreaks and no measles cases because the US was doing very well at having over 95% vaccination rates at schools. And we'll talk a little bit about why that changed and what are some things that can help you in knowing as we move forward with making sure that we keep everyone safe. What we recognized in each of these 17 states was that travel to areas where there were outbreaks, if they had a family member that was unvaccinated, exposed someone to measles, and then when they came back home, they exposed other kids that were also unvaccinated to measles. And that's exactly what's happened here in the case of Chicago. We expect that the number and potentially the number of states that have measles cases in the US will increase in the coming weeks because we're currently in the weeks of spring breaks. So families who have unvaccinated kids may travel to states for spring break, particularly California and Florida that currently have measles outbreaks, and then their unvaccinated kids will bring measles back home to the states that they came from. So we expect more cases of measles in the coming weeks, and we expect more states to also have outbreaks. It's the travel to areas when your children aren't vaccinated and then coming back that is actually causing the spread of measles at this point. Next. The reason that it's so important, I know Dr. Laura touched on this some, is about 1 in 5 people who develop measles will need to be hospitalized because of the symptoms that she reviewed. Of those people that have measles, 1 in 1,000 may have permanent problems with their cognition or their memory or brain after having brain damage if they don't have vaccination. And 1 in 3 cases out of 1,000 of those who have measles can be fatal, which is the reason that we've worked so hard to make sure all children are vaccinated so that they can prevent those symptoms that Dr. Laura talked about earlier. As I mentioned, measles was eliminated in the US in 2000, but around 2005, there began to be some disinformation about measles potentially causing, vaccines potentially causing autism. And so all of a sudden, there were worries and concerns about getting vaccinations. And we saw the vaccine rates in children decrease after that. When schools have about 95% of a vaccination rate, what will end up happening is the few kids that can't get vaccinations because they may have childhood cancers, leukemia, or immune issues, or they may have be Seventh-day Adventists or other types of religious groups that decline getting any type of medical care. But if 95% of the kids around them are vaccinated, then that actually prevents those few that don't have vaccinations from being exposed to a potential measles, mumps, or other type of childhood illness. And that's what we call herd immunity. If the 95% surround those 5, it keeps those 5 safe and keeps the herd safe. Sadly, after about 2005, more disinformation and worries about vaccinations caused families to say, maybe I shouldn't get a vaccination, or maybe I shouldn't have my kids vaccinated. And what we see currently is there's some schools that have only 75% of the children in their schools vaccinated. You can actually check at your school to see what percentage of vaccination rates are your schools and your children that go to school have for any school in Illinois. I just put that link in the chat so that you can see if the children at your children's schools are vaccinated. So we unfortunately, because of that disinformation, had the first measles outbreak in the US in 2019, after 20 years of not having measles. And so doctors weren't even as used to seeing that anymore since it had been eradicated. Since children get their first measles, mumps, and rubella vaccine, or what's called the MMR, when they're 1 year old, and then again when they're between 4 and 6 years old, infants are higher at risk because kids under 1 haven't had their first vaccine, and it's only after the second shot that they really are pretty much safe from being able to contract measles. After that second shot, after about first or second grade, then kids are relatively safe from measles. As Dr. Laura said, pregnant mothers are also at risk, as well as their babies, because their babies haven't been able to get a vaccination to protect them. Next slide. I've got some pictures here so that you can see what measles may look on kids' skins of different tones, because the red measles that we may normally see on television shots and sides may look somewhat different on persons of color. So I've got some pictures here there on the right. We currently have 15 cases of measles as of today, March 20th, here in Chicago. As Dr. Laura said, it is the most contagious virus currently around the world. If 10 people are in a room and one person walks through, 9 of those people that are unvaccinated will get measles. So it's very, very important to get vaccinated. The other important thing to know, as Dr. Laura, I believe, said earlier, is the virus from kids coughing or sneezing stays in the air and alive for about 2 hours after the infected person leaves. So if those 10 unvaccinated people walk into the room after someone's been in there, 9 of those people will likely contract measles. The current measles outbreak that's happened at the Migrant Center in Pilsen, an outside source actually infected the unvaccinated children that were at that Pilsen Migrant Center. So just as Dr. Laura said, everyone is now quarantined. And if someone has concerns or still some may have some questions about, what do I do? Am I feeling comfortable about vaccination? This is a really great article that explains how vaccinations are safe. Millions, tens of millions of children around the world are getting vaccinated to stay safe. And we had no worries about measles from 2000 to 2019, almost 20 years, because we had 95% of children vaccinated to keep all kids safe, particularly those who aren't able to get vaccinated because of an immune issue or an early childhood issue that they may have. If your child has been exposed, if they go and get an MMR vaccination immediately, you can actually prevent them from contracting and getting measles. So if your school notifies you that your child may have been exposed, but they haven't had that 4 to 6 year old measles vaccine, call your primary care provider, let them know right away, because if you get them vaccinated quickly, you can prevent a full outbreak. Next slide. So how do parents that have worries about vaccine think about and make decisions about what the best comfort level they have for their families and for their kids? It's really important to know that although there's lots of information out there, all information isn't good information. So how do you find and think through the best ways to develop and know about good information to make good decisions for yourself and your family? The first thing, and this is actually what's called a decision tree. It helps you to make the best decision when there's lots of information out there. Asking yourself what is real and what may be fake. We know that measles are real, but they're also very preventable with vaccines. And then how do I obtain knowledge and where do I get knowledge from? The person that you trust the most, hopefully, is your primary care provider. If you can look online or look on the CDC website or the CDPH website, which I'll post in just a second, that's also a great place to be able to get information and to feel like you can trust that information. Some people have worries or concerns about whether the government is giving them all they need to know, or if the government might be kind of short telling them what's real out there. My then suggestion is think about the medical center that you trust. Where do people who have all the insurance, all the money, all the wealth go when they need help? Do they go to the Mayo Clinic? Then look on the Mayo Clinic's website. Do they go to the Cleveland Clinic? Then look on that website. Or do they go to Rush, where I work? If you feel comfortable, then look on that website. But remind yourself and always recognize that sadly, Facebook, a WhatsApp group text, or Reddit, those aren't trustworthy places to get knowledge, and they can actually give you more disinformation than real information that you can use. And then think about what are the pros versus cons of getting a vaccine. We know that vaccines are 100% safe in being able to prevent getting measles and prevent spreading measles. And there was some questions about this because when the COVID vaccine came up, the COVID vaccine may not have prevented you from getting COVID, but they prevented you from getting so sick that you had to be in the hospital or so sick that you had to be on a ventilator. And they very much prevented the death that we had, unfortunately, during COVID-19. And so some people felt more skeptical about vaccines after that time. But we always have to know that the best way to keep us all safe is to talk to folks that you trust and make decisions that help you and your family. There were no measles outbreaks between 2000 and 2019 when 95% of all of our kids had vaccines. So we know it saved lives. And sadly, 1 in 5 children who doesn't have a vaccine, if they catch measles, they'll need hospitalization and special care. And that's a stress that no parent wants to go through. So we hope in asking and feeling trusted providers you can talk to that you can get your kids vaccinated after discussing that with your primary care. Next slide.
So thank you for those presentations. I think we have, great information, not only from the clinical part, but also Dr. Sorrell. I mean, it's something important that you mentioned is that this outbreak didn't even originated in the shelters for immigrants. So, as we are seeing, throughout the city, I mean, some, controversial issues, between even between immigrants, right? Among immigrants against each other, right? And especially,
it's a very important concern. And that sadly has been a narrative that's been used against people of color throughout time. In the early 1900s, when immigrants were coming to the US, they were called quote unquote dirty or unclean or sick or unhealthy. And we do not want to use those narratives. What actually happened is that people who were unvaccinated in the US brought the virus to those, unfortunately, that were living in the shelter. And when someone is migrating and having traveled for several months, they may not have been, and kids that were 3 to 5 years old certainly may have missed a follow-up appointment to get a second vaccination. Or young children under 1 may not have been able to get the first vaccination. And sadly, those migrants were unfortunately a large population at risk. But we certainly don't want to perpetuate narratives that sadly continue to leave wedge issues in our communities and are sadly used by others to drive wedge issues between all persons of color. Those migrants who have been here, those of different ethnicities that have been here for 10s and 20s of years versus those who are just coming. All of us have a stake in what happens, and all of us have a stake in what happens for each other. And so we need to not let those negative narratives get in the way of being a help and a positive help for us all.
Yeah, that is so important to mention because it's been used in a political way, of course, and it's very interesting that this has been through history, right? I mean, it's not only in this recent case, but anyway. Thank you so much for that, for Dr. Casalegno, also for the great information you provided. So our friend Catalino, is gonna guide us through the Q&A questions. As you can see, one of the features of your Zoom screen is that you have the Q&A option. So please go ahead and use it. And I want to ask Catalino if you have.
Raul, I'm so sorry. Before we get into that, can I ask Dr. Sorrell, did we finish your presentation? I know that there was some things. Are you okay?
It's okay. I want to always be able to answer questions and make sure that knowledge is out. If it's all right, I will post in the chat that our program also trains agencies, organizations in the community on behavioral health, substance use, and other topics that are also unfortunately more negatively affecting persons of color. So we really want to be available to reach out and help those in need.
Thank you. I just wanted to make sure. I think I noticed that you wanted to add something. Okay, thank you. Sorry about that, Raul. Please.
No, está bien, gracias. Gracias, Marcial, for that. And
Raul,
do we have
Yeah.
any questions?
Raul, do you mind if I ask a question?
Go ahead.
Muchas gracias. Dr. Tanya and Laura, thank you so much for your great presentation. This is phenomenal information. And I really appreciate the last part that you mentioned, Dr. Tanya. My question is, well, I guess I got two questions. One is that our organizations are places where we always want to make people feel welcome. And so part of that is making sure that we have the narrative right. But I know that people that work in the nonprofit sector are also thinking about their own safety because they also go home to their families. And so as people that work in the nonprofit sector, what can we do to feel safe while we are extending a helping hand to our brothers and sisters? That's question number one. And then question number two, for people who are not vaccinated or interested in getting tested to get tested to see if they have the vaccination, are your spaces doing something where people can just come and see you? How would we go about making an appointment, or is there a walk-in day or anything where people can come in and talk to a professional? Thank you.
Do you want to go, Tanya?
I think you're actually working at Esperanza Clinic. I think that'd be a great lead to get started.
Yeah, so I feel like, sorry, and Luis, for the second question, you were asking if like a staff member from an organization has like doubts about like testing to see if they have immunity or like the vaccination records. Yeah. I feel like at Esperanza, we also are very welcoming. I am an infectious disease specialist here, so I don't see kids. That's the only thing. I'm an adult provider, but we do have like, pediatric providers and family medicine providers and an adult provider with an infectious disease background. So if there's anyone that wants to like chat more and know more about their immunity status and how to prevent measles and regarding vaccination history and all that, they can come to Esperanza. They can make an appointment with any of the providers and get more information if they have any questions or concerns about that. We can do testing here for immunity. It's just a blood draw. We look for antibodies against measles, mumps, and rubella. And that way, if people have the antibodies, that means that they've been exposed to the vaccine, or they had the infection like maybe many years ago, depending on the age. So that will show that they have immunity and they won't need to get the vaccine. And if they don't have immunity, we can always give the vaccine with a few contraindications, which is like pregnant people. They cannot get the vaccine because it's a live attenuated vaccine. That means that it has like parts of the virus that it has been kind of like lower down. So pregnant women cannot, pregnant patients cannot get the MMR, and people with like very decreased immune system. For example, like patients that live with HIV and they have advanced HIV disease, they cannot get the vaccine, or people undergoing treatment for cancer, for example. So, but those are all decisions and conversations that any of the providers here at Esperanza or any of the other clinics in the city can talk to any of the staffs in the organizations. And I don't know, Tanya, if you want to address the first question.
And Luis, I may have missed the first one because I actually was typing very similar to what you had just said, Laura, about most, if you work in the healthcare arena, IDPH, Illinois Department of Public Health, and Illinois Department of Human Services actually recommends, and so most work staff recommend that you have those vaccination history or the antibody titer testing done before you're hired. So if you work at a healthcare agency where you had to go and show them your vaccine records, or draw blood, as Dr. Laura said, for that is one concern. If you're of a person that's thinking, I don't know if I've had vaccines, I think this is your question, Louise, and I don't know if I want to get a vaccine. The concern is that even with the N95 mask that Dr. Laura showed, measles is the most contagious issue that we currently in the world are working with. So
Yeah,
even wearing the N95 may not be its best protection from your contracting measles. And so that might be a limiting factor in terms of making sure that you wouldn't get sick. But I think that was part of your question, Louise.
It's part of it. So we are a community-based organization. As such, most of the people here represent community-based organizations that provide service to community members.
Right. Mm-hmm.
And so we want to make sure that the folks that work at our nonprofit organizations feel safe in serving others. And
right.
So what are there any tips that you can share with us where employees at our organizations can take or things that they can do so that they can feel safe as we serve?
Okay. I think that actually is Dr. Laura's question. If they have if they have their vaccine records, they can know they're safe. If they're saying, but I'm getting a little older there, they can always check the titer, get the blood test done to see if they still have antibodies. Particularly, and this is actually a good point, Louise, particularly if they may have an immune disorder, such as lupus, MS, or some immune system where they've been told by their provider that their immunity is low, or if they were told during COVID that they needed to continue to wear a mask because they were at risk, because if their immune system is low, their antibody count that Dr. Laura had mentioned might be low. So they might need a booster to have that additional security. So if you're someone that may take or say, oh wait, I have an immune disorder, or I take medications like prednisone or methotrexate that may lower your immunity, then certainly talk to your primary care provider to see if you might need that blood test that Dr. Laura mentioned to check for your antibodies, or if you might need, and they can advise you if you might need an additional booster.
Yeah. Oh, sorry, go ahead.
No, I think those would be the only things. If a worker was concerned about their status and their risk of contracting measles, those would be the best thing to tell them. If they're vaccinated, or have had measles, if they recall, they're good to go. If they have an immune system compromise where their doctor has told them they have lupus, MS, or some type of immune disorder, fibromyalgia, or they've been told to wear a mask because of their immune system, they can check with their primary care provider to get their antibodies checked to see if they may need a booster.
Yeah, and with the caveat that people that have immune compromise or they take like prednisone or they are pregnant or like have advanced HIV or other immune system issues, sometimes they cannot get the booster. So they have to like protect themselves with like wearing an N95. I think I would probably, if someone, let's say, cannot get vaccinated, they don't have any proven immunity. Let's say someone did get vaccinated many years ago and now like the immunity has waned, so it's lower, and cannot get the booster because like that staff member is pregnant. That person should probably wear an N95 whenever it's like in contact with someone that is like suspected or at risk for measles. Of course, if let's say that a client comes to an organization and there was no maybe triage before seeing the client, and the client, when you start seeing the person is like having active symptoms, And if the staff member has like is pregnant or has any issues with immunity and has no proven immunity against measles, I would not go near that person, unfortunately. Even with an N95, like Dr. Tanya was saying, because it's so highly contagious that I would probably avoid. And I think, Luis, going to your first question, it gets super tricky because you don't want to stigmatize people, but you also want to protect your staff. So that's where it gets a little tricky. How do you fight the stigma? How do you fight, making people feel, sick or that they can infect other people? How do you manage that? And I feel like there's ways of kind of addressing that. We can always tell our clients, we're in the midst of a new outbreak from a new virus that is highly contagious. We have to protect ourselves, and we have to kind of implement universal measures with everyone that is like coming to our institution or organization. So I would say, if people wants to wear a mask and or tell our clients, like, if you're having any flu-like symptoms, just wear a mask, because we have to be protecting ourselves. It doesn't matter if you're coming from a shelter, from your house, or whatever. Maybe just like implementing universal protective measures, so no one will feel like pointed out or stigmatized, while we also protect ourselves. If that makes sense and answers your question.
Yes, and the N95 and a face shield, and we forget about those, but they also serve as good blocks. N95 face shield, and also that person may choose to have a HEPA filter in their office that actually goes through and purifies the air every 30 minutes and then removes any harmful viruses from the air. There are lots of things that we can do, and sadly, we may not always know to do. But the N95 face shield and a HEPA filter can be a good method during that time to try to make sure that employees stay safe. Many agencies beefed up their HEPA filtration during COVID. And may keep that, but I know we sometimes get a little bit complacent as time goes on, to remember that we need to make sure that we keep safety for all employees in mind.
Yeah, and the CDC website has like very, very valuable information about infection control. And thank you, Dr. Tanya, for mentioning all this. I didn't want to go into like a lot of like detail on the infection control side, because like I am not sure like how, like what organizations we have in the call, but yes, isolating room with like HEPA filters, N95s, and then of course, if an organization has like a negative pressure room, that's ideal, but I don't know if everyone has like that. So those are all measures that we use on infection control to reduce the transmission, particularly of airborne organisms, like measles is airborne. So it stays in the air for longer. So that's why we need HEPA filters, N95s, and also once the patient or person that has the infection leaves, the room has to be closed for 2 hours to allow the virus to kind of like die. Could be, I think, 1 hour if you have a HEPA filter, but with like, to be super safe, 2 hours with the door closed. And then you can clean up the room with like the usual cleaning products that you would use in any like healthcare setting. But all that information is on the CDC website.
Yes.
That I put on my presentation.
Thank you, Doctor. We can proceed with another question. Casalegno, I think you have a couple there.
Yeah, I have one. It's anonymous. What will be some of the symptoms that adults can experience after getting the vaccine if we find that we don't have immunity?
Meaning like side effects to the vaccine?
Yes. Yeah, so what will be some of the symptoms that adults can experience after getting the vaccine if we find that we don't have immunity?
Okay, so if someone gets, they don't have immunity and they want to get a booster, it's a live attenuated vaccine, so it can have some side effects, but it's like maybe fever, myalgias, like body aches, like fever, but it shouldn't last like more than a day. So it's pretty safe. And you should not get sick from the vaccine. I think I always emphasize that to my patients, because like a lot of my patients don't want the flu vaccine because they get the flu. The flu vaccine, for example, it's the same. We'll give you some like body aches, some like maybe some fever, but you should not get like cough, sneezing, sore throat. That's flu or other viruses, and that's probably that the person got sick from it. So side effects to vaccine are those, should be mild, should be like short-lived. So it's a good vaccine. We should get it if we don't have immunity.
Yeah, the most common thing that people notice is if they get it, the arm that they may get the shot in may get a little bit sore, or you might see a little bit of a raise right there at the site. And I always remind people too that small achiness that you might notice or feeling like a little tired, that's actually your body taking a copy of that vaccine, of that virus, and saying, hey, the next time you see that virus, you attack it. All of our antibodies actually have what's a little bit of code on it that said, this is Casalegno. So anytime we breathe in something that might be a virus, there'll be an antibody that'll check and say, is this Casalegno or no? And that's literally how the antibodies will work. Well, this isn't Casalegno, so I'm gonna beat it up. And so that little bit of soreness that you get the day or two after a vaccine is your body learning to recognize, okay, the next time I see this little virus, this attenuated virus or this active piece, I'll know to attack it because it's not Casalegno. And then the next time you get exposed, or if you're working with someone that may be exposed, then those antibodies will come and they will immediately start to attack it. And that's why that people don't get sick after they have the vaccine.
Okay, the next question comes from
after 3 p.m., but Doctors Casalegno and Sorrell have been very, very generous with their time, and of course they are willing to stay longer. If you have more questions, so continue on using the Q&A.
I'm sorry, Raul, I'm so sorry. I do have some patients to go see.
Okay.
So unfortunately I have to jump off the call, but thanks everyone so much for putting this together. I think this is like extremely valuable for the community. And let's support our migrants, and anything you need from an infectious disease provider in the community, just reach out to Esperanza. I'm here like almost always.
Thank you so much, Dr. Laura Casalegno, for your time. Okay.
Thanks everyone.
We still have Dr. Sorrell for questions.
Yeah.
So Catalino, do we have other questions?
Yes, this question is from Veronica. Is there an initiative in progress to get our new neighbors vaccinated? And if they're not already?
Very good question, Casalegno. It's actually Rush's Center for Transforming Health and Housing that has been working in the shelters here in Chicago for now almost 6 years. They started just prior to COVID and actually have increased since COVID. They have been working to make sure that all new migrants have their vaccinations up to date. If you remember in my discussion, you don't get that first MMR or measles, mumps, and rubella or red fever shot until you're 1 year old, though. So an infant that's 7 months old would not be able to be vaccinated. That's why we have to get all those other folks around them, that 95%, to make sure that we provide that herd immunity that we mentioned. But if everybody else around them that's over 1 gets their measles vaccination, or if they're kids that are 4 to 6, that we make sure they get their second, then those kids that are under 1 year old or a pregnant parent will be sure that they're safe because they'll have that herd immunity that we talked about. But yes, we're currently working to make sure and shore up that everyone is vaccinated. Great question. And my clinic doesn't start till almost 4, so we've got a little while. Not quite till 4, but we've got a little while more for more.
Okay.
The next question that we have is anonymous. If I got vaccinated more than 40 years ago, do I need to consider a vaccine booster now to reduce the risk to get measles if I work with people while that may be affected?
That's a good question, whomever asked that. Usually when you get that last MMR, which you normally get between 16 and 18-year-old, it lasts all your life unless you have an immune system issue. If you have any question or concern, though, your primary care provider can take that antibody booster titer, and that's just a little bitty pool of blood to make sure that those antibodies that will fight a virus are still there in your system. And if they are, you're good to go. For over 95% of people, once they have that last booster between 16 and 18, they have full immunity for the rest of their lives.
Okay, the next
Yeah, that's important to
question.
know, because if I can just like very briefly, say that for all those who are immigrants from Mexico, like I am, the vaccination, especially, measles was among others, where they were mandatory. So in order to get to school, you need to present your cartilla de vacunación or your vaccination card. So of course, I mean, for people like me, that's like more than 4 years ago, of course, right? But it's good to know that there's a possibility to get a booster, right? If we didn't get the vaccination after 16 years old. That's all. Yeah, and Dr. Sorrell, is this a booster available at any community clinic, at any hospital? We just have to ask our doctors.
Just even your primary care, because most primary care providers see children through adults, so they generally have a stock supply of the MMR, measles, mumps, rubella vaccine on hand. They actually, CDPH has been shoring up supply to make sure, specifically in areas where people may live that have been exposed in that Pilsen area and slightly across over headed toward Cottage Grove, the King Center. They actually have vaccine clinics this week, and I can post that in the chart for you, in the Zoom link for you guys, because several of the WIC sites, the community centers that CDPH has, have vaccine clinics free this week, so that if you have a question, they can do a titer or do an updated booster, and I'll get that for you in just a second.
Thank you.
Left.
Okay, next question, Catalino, por favor. I think you're muted.
Okay, how do we know the measles came from outside the shelters?
They actually are able, and many people have seen these movies like Contagion, where they actually can trace the first person that ever got the virus. And that's what they do. They do what we call contact tracing. So someone who tests positive for measles, they ask, where were you and who were you around? And then they call all those people that were around them and say, where were you and who were you around? And they can actually trace all the way back to who we call patient zero, are the first person that actually contracted the virus. And they can tell, since they know what symptoms happen when over the course of the 2 to 3 weeks that someone has measles. The first couple of days, you'll have the sneezing, coughing, runny nose. By day 5 or 6, you'll start having the actual breakout in the rash. So they can tell exactly when a provider sees you, you're about on day 14. So where were you 2 weeks ago? And they actually were able to determine that someone had traveled outside of the Chicago area and they were unvaccinated, and they brought a case from their exposure back to Chicago. That was the reason. And if you saw that slide that had all the different states, that we're also concerned that many people went to California and Florida during spring break these weeks during March. And both of those states currently also have measles outbreaks. And Florida in particular isn't actually telling people to kind of stay at home if they've been exposed. And so people that may be exposed and don't know that they have measles yet may unfortunately be sneezing or coughing and be spreading that measles virus that lives 2 hours even after they walked away to other people that aren't vaccinated. And I put the link in the chat for the different clinics and vaccine clinics that are going on by that the CDPH is having. But they were actually able to track down to patient zero for the first person in the Chicago area that became infected with measles.
It sounds like it has a passport. I've always heard that something goes from an epidemic to a pandemic when it has a passport? When are we at that stage?
Well, the
When
good
does-
thing about being able to have and request that people quarantine and that they stay for 21 days, as Dr. Laura said, is if you're staying at your house, you're not spreading it. And so if everyone who may be exposed that isn't vaccinated, now once they determine you're vaccinated or you have good titers, you're good to go because you're not spreading measles. But anybody that has been exposed and hasn't been vaccinated, they're asking them to stay at home for 21 days to make sure that they don't develop measles. And then the measles will then, as they say, die out because measles can't start if someone's already vaccinated. So it won't spread to, as they say, a pandemic. And we're very thankful for that. But we're also really encouraging everyone to get vaccinated because when we get that 95% of herd immunity, then the couple of folks that aren't vaccinated are safer because we've got everybody around them also safe. So nobody is spreading measles. Great question.
All right. Next question.
Next question comes from Michelle. Does anyone know what sick shelters are being prioritized to get vaccinations? And is it recommended not to visit shelters if vaccinated?
The CDPH has their list of who the priority shelters are. Of course, because we don't want to perpetuate what might be a stigma or what might further cause division in the community, they may not be making that information public as to which shelters they're prioritizing, but they do know where they need to prioritize not only vaccinations, but also quarantining. And then to make sure that everybody else is vaccinated up so that we can get the herd immunity at those shelters. That doesn't mean that if you're providing services at a shelter, making donations at a shelter, as long as you're vaccinated, you're good. And I think that's the thing we don't always remember. If I'm vaccinated, I'm good to go. We work at warming centers. We go out to CDPH sites. We'll be helping our team at Rush. Will be helping them at some of these sites. So, but I'm not worried about going out because I know I've been vaccinated. Many of us, if we're a little bit old there, we even have the little it looks like a little swoosh mark on our arm when we got the smallpox vaccination. Right? I won't ask for a show of hands who've had that. But the reason that people don't even need the smallpox vaccination anymore is we were able to get so many people vaccinated. We had herd immunity, and we've had herd immunity so long, we say that smallpox is eradicated, that it doesn't happen anymore. And
Right.
unfortunately, when we don't keep up the herd immunity, that's when these outbreaks occur.
Right. Do we still have more questions, Catalino?
There's two in the chat. There's one from Maria. If you get a booster, do you need to quarantine?
If you've been exposed, I'm trying to circle back to what we posted earlier, since those who have been exposed. If you've been exposed and then you get a booster, they may ask you to quarantine for your safety. But if you just get a booster without having been exposed, then you're good to go and you don't need to quarantine. It's the exposure to measles that may require a quarantine, not just getting a booster shot or getting a test to check your antibodies and they say, oh, your antibodies are low, so we're going to give you a booster. It's just the exposure that then requires the quarantine. Great question, though.
Understood. And one more, right?
One more. This is coming from Veronica. How are the shelters working with families/clients that refuse to get vaccinated?
You know, that's a really good question, Veronica, but most people around the world are happy and thankful that vaccinations are available to prevent these childhood illnesses. It's sadly only high resource countries that have been infected by disinformation and have started to kind of wonder about is this a good idea? Is this a bad idea? Will this cause autism? Will this cause issues? People who unfortunately may have had a tough time, they've seen people who've had polio and can't walk anymore. So they were thankful when the polio vaccine was available. They've seen people with measles or chickenpox and how devastating that can be for a kid. So when a vaccine is available, folks are happy to be able to get one for their kids. So we thankfully not had vaccine resistance at the shelters, but that's a great question. And no one wants to see a kid suffer, to feel like, okay, I'll go ahead and get one now. But we all know that there are questions that people may have, and they're very valid questions. And we want to be able to answer them, and also to be able to provide folks with good information, not disinformation, because sadly, misinformation can sometimes come when folks are trying to get us scared of our own selves and get us scared of things that we know have been helpful and working for decades. And we don't want to accidentally buy into that, because then nobody wins. Nobody stays healthy. And we have to work together to keep everybody healthy. But great question.
Right. So I think, that because Dr. Sorrell has been so generous with her time, probably we have time for a last question. And maybe you can just unmute your Zoom and then, voice your question if you have one. I think we're good.
I have questions in the Q&A or the chat.
Okay. Go ahead. Okay, so well, thank you so much, and I think
Can I
this
add
was a
something?
great session.
Can I add something, Raul?
Yes, please go ahead, Marcel.
Thank you. I couldn't unmute fast enough. I apologize. Shameless plug. We do have, I hope that you all found this training to be productive and beneficial. With that in mind, like Luis mentioned, we're always looking to bring more resources to the network. Just wanted to mention that we will be sending an RSVP next week to sign up for the immigration 101 training that is coming up, and there's further coming your way, but didn't want to miss the opportunity to share with this group. We will be blasting that so that everybody receives the benefit and can successfully join us. Thank you, Raul.
And
Right, and Dr. Sorrell, I think you put something in the chat. You want to talk about that?
if this talk was helpful for you, or if you like that providers really want to get information out to you and helping you make decisions about your health and helping our community, please feel free to reach out to us. Our service, the Rush Substance Use Disorder Center for Excellence, provides free bilingual mental health and substance use training in communities to make sure that we can keep all communities safe. Viví a la frontera en Arizona más que 12 años. Entonces es posible para todos nosotros a trabajar con usted, a subir la comunidad. So we want to be able to help everyone.
Excellent pronunciation.
Gracias.
Okay, so we can end the session with that note. Please stay informed, and see you next time. Okay. Thank you, everyone.
Thank you so much. Please feel free to reach out. Take care, everyone. Be safe.
Thank you. Thank you.
Thank you so much, everybody.
Have a great one.
Bye. Thank you.
Bye, Michelle.
I think we can end the recording now.